we analyze this and we want to find 1, 2, 3, maybe 4 different areas that we can work on extremely precisely. What we don't do, we don't go up and down the spine and just try to push on everything and crack and pop everything. Hey everyone, Dr. Todd here from Gonstead Spine and Wellness. In this video, I want to talk about what does a chiropractor do? And I'm going to try to keep it as simple as I can, but I'm also going to try to cover all the bases since there's a lot of range from one chiropractor to the next. But before we get started, make sure you like and subscribe, comment, do all that stuff. And we serve 2 audiences. One is the public that wants to learn about natural health and healing. And the second one is chiropractors who want to add functional movement, corrective exercise, and these systems into their chiropractic practice. You'll see the respective links below. So let's talk about what do chiropractors do. So I have a couple of props here. One is a spine with a pelvis, and then one is a thoracic spine, no discs, no ligaments, held together by a bungee cord. And I figured these would be good ways to illustrate. The first thing is what chiropractors do by definition is we look for this thing called a subluxation. And so a subluxation is an older term in chiropractic. You'll have some chiropractors that don't like that term. They want to call it a segmental dysfunction or an intersegmental lesion or something else, okay? But at the end of the day, we can argue on semantics. What we do is we're trying to find joints that have a problem, and we're trying to help reduce that problem. Now, we practice a method called Gonstead, so our speaking points, our understanding of what a subluxation is a little bit different than some other techniques, but all in all, I'm gonna try to give you a good overview in this video of what chiropractors really do. So first off, we look for this thing called a subluxation. Just bear with me if you're a chiropractor or a patient watching this and you don't like that term. I'm gonna use the term anyway because that's what this profession was founded on. So this is the front of the spine, this is the back of the spine. You have a bone, there's a disc in between, there's a nerve that comes out the middle. Maybe I should use this one because it'll show this a little better. Yeah, it's better. So bone, disc, bone, nerve in between, and then there's a spinal cord that runs right down the middle in this hole called the spinal canal. So before you understand what we do, you got to understand how the body works and why this even matters. Okay, so the way that the body works, and this is irrefutable, no one can argue this. If you've learned human physiology, human anatomy, then this is stuff you learn, no matter what type of healthcare practitioner you are. Your brain sits up inside your skull. The brain continues as the spinal cord. It runs down through the spinal canal. It branches off into 31 pairs of spinal nerve roots. Those nerve roots branch further and further and further until you have little neurons, small little tiny cells of nerves that connect into every single cell, tissue, and organ in the body. So the nervous system is the central processing computer of the body, and the way it connects is through these wires, which are nerves. Now, that's how the body works. What do chiropractors do? Where do we come into this? Well, we come into this when things could potentially go wrong. So how do things go wrong? Well, trauma. Trauma can cause a joint. I'm gonna use this one because it's a little more easily movable. Trauma can cause a joint to misalign. What way does it misalign? Well, in most cases, because of the anatomy of how the spine is put together, the joints will typically misalign backwards predominantly. So they go what's called posterior. Now this is the mid-back, so it misaligns backwards, and due to the what's called the facet joint, so this little joint surface here, which is pretty much vertical, that controls how much the joints move and also how they can misalign, and gives you an idea of what vector or what direction of correction is going to be most advantageous. So in the thoracic spine, you have all these ribs that come out. They're not pictured here on this model, but you have 12 ribs in the whole rib cage. And all in all, it holds the mid-back area of the thoracic spine pretty stable. What can happen, bones can misalign, they come backwards, and we have to find out where exactly those joints are misaligned, and then we need to try to correct it. This is where some of the argument comes in place between chiropractors fighting internally, between other healthcare providers and each other, is some of them will argue that bones don't physically misalign. And they'll say, well, if you take an x-ray and you adjust someone and you have a before and after x-ray, you're not gonna be able to measure the difference in how the bone is aligned. Well, in a lot of cases, that's true. It's hard to measure it because it's a millimeter or a fraction of a millimeter of misalignment. And another reason that there's some truth to that is because changing the position of a vertebra with an adjustment is not necessarily our main goal anymore. And I say anymore because early on in chiropractic, that's the way that it was explained to us as chiropractors. I'm talking about like way back in the day. And that's the way that we explain it to the public, and that's the way a lot of public understand it. They think bone out of place. Bone is out of place, pinching a nerve. Oh, I got a pinched nerve, and we're gonna put the bone back in place, kind of like a dislocation, you know, and then things are gonna go on and be fine. That's not necessarily how it works when you have a subluxation in the spine. One of the biggest components of a subluxation is not necessarily gross misalignment, but it is fixation. It's that the joint does not move and articulate properly. And moments ago, I talked about the different characteristics in each part of the spine. Like in the mid-back, you have these facets that are more upright. That controls how the vertebra misalign. So in the thoracic spine, because of the ribs and the facet orientation, these vertebrae can misalign backwards. They can wedge, they can go back and forth a little bit, and they can rotate a little bit, but it's pretty limited based on the anatomy and the ribs. In the neck, it's different. So in the neck, there's no ribs. There's more rotational misalignment that can happen, like in the upper neck, for example. Lots of rotation takes place in here. There's more lateral bending misalignment that can take place in the lower cervical spine based on the orientation of these vertebrae, having a stable thoracic rib cage, and then having a fairly mobile and flexible type of neck. The transition point is an area that is just very susceptible to having problems. And then in the lower back orientation of how these joints are aligned or put together, when you have a misalignment, in most cases, the vast majority of the misalignment down here is posteriority. There's not going to be a lot of rotation because these joints down here protect against excessive rotation, because the excessive rotation actually tears up the disc, which is also a reason that when you bend or you lift, and we just did a video on this, I'll link it up above, the worst thing you can do is flex and rotate, because that starts to unlock some of the protective mechanisms of the spine here, and it puts a tremendous amount of rotational shear on the disc, and it can tear the disc, herniate the disc, and cause all sorts of problems there. So the title of this video was, what is it that a chiropractor does? And I had to explain how the body works. I explained what this subluxation is. There's certain disagreements between professionals in chiropractic and in other healthcare fields as far as what exactly happens when there's a problem in a joint. But at the end of the day, I think most chiropractors will agree that we are putting a thrust or a force into the spine that is controlled, trying to reverse something that's bad, something that is bad, which the consensus shows that the thing that's bad is joint fixation. All right, it doesn't move properly. Now, that's kind of basic chiropractic. That's what a chiropractor does. You find and you fix the problem. How you find it, there's a variety of ways to do that. And there's different chiropractic techniques, and there's different levels of precision and specificity. And there's different levels of care that the practitioner was taught is important or is not important. For example, in the Gonstead work, we're taught that precision is extremely important. So we go through this process of taking these 24 vertebrae, the sacroiliac joint, the segments of the sacrum. We analyze this and we want to find 1, 2, 3, maybe 4 different areas that we can work on extremely precisely. What we don't do, we don't go up and down the spine and just try to push on everything and crack and pop everything. You'll see plenty of videos on YouTube where chiropractors do what looks like the same thing on every single patient. It's something that a lot of other specific chiropractic techniques refer to as the flying 7. Hit them high, hit them low, roll them twice, let them go. That's gross manipulation. That's not really what our chiropractic profession was founded on. And from a little over 18 years in practice to date, I feel that it's very important to be specific as much as possible. That's the world according to me. That's the way that I practice. I was brought up in the Gonstead work, which is a very specific type of chiropractic. So that is my take on it. Now, a step further on this, just to touch back on one more concept before we wrap up this video, we talk about alignment. We talk about physical alignment of a vertebra, that the adjustment typically doesn't influence that a lot. There are cases where it will change the alignment dramatically, but that's not the majority of the time. Someone has a really acute misalignment, sometimes in a child, a big misalignment. Before the ligaments have deformed and accustomed to that misalignment, things can be changed and moved measurably quite a bit, but it has to happen right away after an injury. This is something that I've seen clinically over the years. The majority of the time what we see is we see patients that have some sort of measurable misalignment we can see on x-ray. The x-ray is not where we find the problem. We find the problem on the patient, and then the x-ray tells us how to best fix the problem that we found on the patient. That's another maybe misunderstanding of chiropractors or the public is that they look at an x-ray and they say, that looks misaligned, so that's what I'm going to work on. Oftentimes, the things that look the most misaligned are compensating the most, and segmentally, there can be a fixation, a joint misalignment that is causing many areas to grossly misalign above, but the way to actually adjust is you want to find the segment that has the most clinical criteria on exam. If the spine is shifted over to the side though, how do you fix that? Does that just magically go back to neutral once you fix the offending vertebra in question? And the answer is, in most cases, no. If the person's had this problem for an extended period of time, like I just mentioned a second ago, you have deformation of ligament. You have deformation of disc. There are 10 ligaments that connect one bone to the next. There's ligaments that go in between the spinous process, in between here, in the front of the spine, in the back of the spine, right in front of your spinal cord. There's all these ligaments that hold things in place. And so when something is misaligned and contorted and deformed, those ligaments deform as well. They become accustomed to that misaligned position. So how do you fix that? How do you change that? I'm going to link a video above for one we just did on a head shifting video where we showed that when someone's head is shifted off to the side, segmentally, subluxation-wise, the problem might be down here at T4. But is their head going to shift back to neutral when you work on T4? Depends on how long they've had it there. Like I just said, if they had it there for an extended period, it's not going to. So there's specific ways of changing gross alignment. And when you change gross alignment, you can improve segmental integrity of the segment in question, meaning if that's the one that's causing all the problems and the head is shifted way over here, that one is going to have problems ongoing. And from a chiropractic standpoint, we're going to be adjusting them over and over and over again because there's all this mechanical stress and load on that segment. If we can get that segment moving, help get that joint to start to heal, and bring this over so that it balances more uniformly, that now reduces mechanical stress to that segment and the entire region of the spine. And I feel like that's a win-win. That's addressing posture. We use a technique called chiropractic biophysics to do that. The third component of what we do is we also look at movement patterns. So we measure someone's movement. We see if it's within normal ranges. There's certain normals that people are supposed to go through when they move from point A to point B. And if they're not moving properly, then we identify that and we teach them how to move properly by addressing something called functional movement. So that's how we do it. We address the segment, which is where this video started. We address the posture and we address the movement. I hope this video gave you overview or perspective on what chiropractors do and then what we do specifically in our clinic at Gonstead Spine and Wellness out here in Meridian, Idaho. That's it. Dr. Todd signing out. Leave some comments, questions below. When it comes to the health of you and your family, results matter most.